Welcome to the PCOS Society of India. As a founder president of the organization, I welcome you all to be part of our organization, which is a multidisciplinary organization consisting of specialists and experts from various fields of medicine who look after women with PCOS and even young girls and even children. Our organization is focused on education of the doctors and education of our patients. With the recent Vijayata program, which we have created through the support of Philips India, we are reaching out to women all over the country. And I request all of you to be part of this program, to take this complete agenda nationally and to educate our women on how they can prevent complications for themselves in future. I also request you to become our members, because that is what is going to help you in updating your skills in this field, which is really a very growing area of treating women and preventing problems in future. Thank you very much, all of you who have been with us, and I look forward to interacting with you in many, many more programs to come.
Good afternoon all. I, Dr. Priyanka, on behalf of PCOS Society of India, I welcome you all for today's panel discussion on a very important topic, diagnosis of PCOS in adolescents, which is becoming the current epidemic. So this webinar is being brought to you by Vijayata the Winner project, which is an awareness project in which we are striving to create an awareness on PCOS all over India. And we do this by conducting seminars at various colleges, corporates, offices, and reaching out to women and adolescent girls. This is an outreach project by the PCOS Society of India and is being supported by Philips. So let us start by understanding what is PCOS. PCOS is a short form polycystic ovarian syndrome. One in every Indian woman is suffering from PCOS, and it is in this context that we call it as the current epidemic. After the onset of menstruation, it can occur at any age. However, the majority of women are diagnosed between the age of 20 and 30 years. It is also one of the most frequently observed cause of female infertility. So coming back to today's panel discussion, we have Dr. Sujata Kar ma'am, who is going to be moderating today's panel discussion. Dr. Sujata Kar is practicing gynecologic endoscopy and assisted reproduction since last 28 years. Her area of interest include PCOS, proteomics of male infertility, scope of stem cells and gynecology. She has won several awards and achievements, including delivering the first IVF baby and the first laser-thatched baby of Odisha. She has several PubMed index publications related to PCOS and male fertility. She has also written many chapters for books and newsletters. Let me introduce you to today's panelist. We have Dr. Madhumita Mohanty ma'am. She is an obstetrician and gynecologist based in Cuttack. She is currently practicing as a consultant sonologist and laparoscopic. She has special interest in ultrasound and infertility. She is a life member of FOXY of Indian Menopause Society, ex-secretary of IH Odisha, present secretary of ISA Odisha. She works for the upliftment of health issues of women in Odisha. Next, we have with us Dr. Lipika Moharana ma'am. She is an obstetrician and gynecologist based in Cuttack. She has done her fellowship in reproductive medicine, clinical embryology and ultrasound in subfertility and PCOS. She has completed a diploma in sexual health and subfertility. She is a member of FOXY Sexual Medicine Committee, Managing Committee of PCOS Society of India. She has been awarded as ISA Youth Icon Award 2023. She has many chapter contributions in FOXY Handbook of Infertility and fact sheets for the ISAD and PCOS Society of India website. Her special interests include PCOS, reproductive genetics, male subfertility, sexual health, reproductive immunology, ultrasound, and subfertility. Next, we have Dr. Sachin Dalal sir. He's a consultant gynecologist and IVF specialist. He's practicing as a consultant at Madhu Hospital, Bhandu, Fortis Hospital, Mulund, Embryon IVF, Vikhroli. He has won several various MGOS awards. His area of interest include teaching fertility concepts and laparoscopy. So I welcome once again all the panelists. and I would request Dr. Sujata Kar ma'am to take over and start today's discussion. Over to you, ma'am.
Thank you very much, Priyanka. So good afternoon to all of you, my panelists, Dr. Sachin, Dr. Madhumita, and Dr. Lipika. And a very good afternoon and welcome to all the people and girls, women who have logged in from all over the country. Welcome, and I hope today's discussion by us is going to be of much use, and it will help you in understanding what PCOS is and especially about adolescent PCOS. So today we wanted to discuss, and the most important thing is that between the four of us, we have something very much in common. All of us are very fond of PCOS, and that is one of our topics of interest. So we would now like to discuss about the adolescent PCOS that actually is becoming an epidemic. I'm sure all of you agree that we have started seeing a lot more than expected girls and women with symptoms which could be PCOS in our OPDs. In fact, in my OPDs, Lipika practices specifically a PCOS clinic. I think Sachin also has I don't know if you have a dedicated PCOS clinic, but I do see a lot of PCOS girls these days. So let's talk about, there's no doubt that this is a global phenomenon and PCOS incidence is rising all over the world. In fact, there are some Indian data also. There was one publication from a school in Mumbai which said that 30-40% of girls were having symptoms of PCOS. So my question is, I would like to ask all of you to answer, ponder about it and answer each of you. What do you think it is? Is it because the diagnosis is improving? We know that the ultrasound facilities have increased. The number of ultrasounds have increased. People are doing much more for everything. They're doing an ultrasound. And the ultrasound...
Patient demanded.
Yeah. And the patients and the ultrasound machines are also becoming very, very highly capable, good quality machines. So whether we are overdiagnosing PCOS or there is an actual rise in incidence of PCOS. So let us start with Sachin. Sachin, what is your view?
Hello, ma'am. Thank you at the outset for letting me on this panel and sharing my thoughts on PCOS. Yes, as you rightly said, PCOS is very close to my heart, and especially reproductive endocrinology as taught to us by Dr. Durusha, who was our teacher. So I believe that the age at menarche is reducing gradually because of the excess body weight of this young adolescent girls. And we are now seeing such a strong correlation between a high body weight and increasingly younger age at menarche. Now, when this is not controlled, what normally occurs is that in the school, we have a good physical education program going on up till 8th and 9th, and from 10th onwards, once the tuition classes and everything starts, the physical education takes a complete backseat. So there is no exercise that actually goes on a regular basis. It's becoming so competitive. So yes, one, the age of menarche reducing. 2, increased body weight among the girls. 3, lack of exercise. And 4, as you rightly said, more awareness because of all the programs and media about PCOS. So it is actually increased and more awareness as well. That's what I feel.
What do you feel, Dr. Madhumita? Do you really feel that we are overdiagnosing it?
Well, to a certain extent, maybe overdiagnosis can be a part, but as doctors already said, changes in the lifestyle, there is no exercise and the propensity to eat all these fatty foods. So obesity and all is increasing. We are also more aware of it with constant updates. So yes.
Also, don't you feel that the overdiagnosis may be because many of them are coming with ultrasound reports and too many ultrasounds are being done? They are coming to you.
And then they are all abdominal ultrasound, so not a TVS one. So yes, there is a certain amount of overdiagnosis for sure, but there is definitely an increase in PCOS in the society. Yes.
Correct. Lipika, what even you see a lot of PCOS
yes, ma'am.
And of course, you being a dedicated PCOS consultant, patients may be coming to you when they are short PCOS. But what do you feel amongst your peers, your children of your staff, your friends, whether it is actually increasing amongst adolescents?
Ma'am, there is a definite increase in incidence. There is no doubt about it because the lifestyle changes, the electronic device addiction, the way they are using mobile and electronic media for even for education, for accessing articles, for web series, for whatever reason, but the electronic device addiction has increased manifold. The outside binge eating, unhealthy foods, junk food, that has increased. So there's no doubt there is actual increase, and there is overdiagnosis.
So what you all suggested, sorry to interrupt, so what you suggested, even Sachin and Madhumita suggested, that obesity, lower physical activity and bad food. So that is certainly driving the obesity epidemic, which is another epidemic. But currently we are talking about PCOS. So yes, PCOS, how that is linking, how is the obesity epidemic also linked to the PCOS epidemic, if you can make it clear? Because we know that all obese girls are not PCO.
Not PCO, yes, ma'am. Yes. And moreover, adolescents, this age group is again a transition, wherein everything is a transitional phase for the reproductive axis. Be it the hyperandrogenic features, they also start having pimples, small pimples as a transition. Might not be a PCO. Only for that reason, this age group has a group of patients who are labeled as at-risk PCO. Because they don't, and even the Rotterdam criteria doesn't fit into this, because they do not have that. PCOM is not taken into account, because they mostly have abdominal ultrasounds. Mostly, ma'am, it's around 99-100% they have abdominal ultrasounds done by radiologists, and always it's written that PCOD clinical correlation required. So we just have the menstrual cyclicity history with us, we have the hyperandrogenic features to see, and we take a good history regarding their lifestyle. That's all. And as far as adolescent PCO is concerned, ma'am, most of the girls I have come across are obese. That's one thing. And they are in the college, late school, like 9th, 10th, 11th, 12th girls. They come to me very often with significant cosmetic features like acne, hirsute, because my husband is a dermat and we have a PCO setup. So commonly we both of us approach them together. And somewhere within, ma'am, I feel this overdiagnosis is required because of the associated comorbidities they're going to face in future. So it's important to make them cautious about their unhealthy lifestyle and the way they are living lives. Even if you say them that you don't study from their mobile or switch off your mobile by 11 p.m., they say your days were easy. Nowadays, it's very competitive exams are becoming difficult. We have to study till 3 a.m. If I tell them have a healthy sleep of 8 hours, they say I sleep at 3 a.m. Ma'am, I wake up at 11. So I have a 8 hours sleep. My answer to that is that's not your normal diurnal rhythm. So that's not how your body is made up of. You should sleep healthy 8 hours of sleep.
Right. So if I may sum up what all the panelists said, is that yes, the diagnosis, the PCOS incidence has risen, no doubt about that. And yes, we are also overnight diagnosing to a certain extent, because we are not everybody is in the same page where the diagnosis is concerned. Even the sonologist wants to diagnose as PCOS, so that's not correct. The woman or the girl herself wants to diagnose herself as PCOS because she's reading it all over the place. It's there everywhere, like Sachin said, social media, TV, this, that, everywhere, PCOS. So they are also a little bit here. They're coming and saying, do I have PCOS? So yes, the diagnosis, the incidence certainly has increased. The diagnosis also has become better, but overdiagnosis also is there. But since this is for the general public, we are not going to go into the details of diagnosis. Yes. So all three factors are there. Here I just want to make another point, clarify, is that we have to understand that obesity epidemic and PCOS epidemic, both of them are there, but they are not the same. All obese girls are not going to have PCOS, and all PCOS girls are not going to be obese. But there is a link. We know that obesity will aggravate the symptoms of PCOS. So a girl who probably doesn't have too much, is having the genes or the genotype or whatever of PCOS, is not having too much symptoms. If she puts on weight, abnormal weight, then she is likely to get aggravated into full-blown PCOS, right? Okay, so now let's come to the next part of our problem, is that the diagnosis. Now, how do you feel in your practice, Sachin? How often do you face patients or girls who come to you with a diagnosis of PCOS, taking an ultrasound report only? And what can you do about that?
So honestly, that used to be the problem. But after the 2023 PCOS guidelines that have come, the guidelines very clearly say that up till the girl is in the adolescent age group and she does not become an adult, you cannot diagnose PCOS on ultrasound. So this, what I have done is I have shared this with the radiologists in my area and sensitize them to the fact that up to the age of 18 or 8 years after menarche, you cannot label a particular girl as PCO. That is one. Secondly, we do our own ultrasound. So a lot of times the girls come. So we just tell them, sensitize them that you got bulky ovaries. It's not PCO. If you don't take corrective actions like healthy eating and most importantly, target the insulin resistance, you will end up in PCOD, diabetes, syndrome X. And last but not the least, what I do is our Royal College of Obstetrics and Gynecology UK. They have a fantastic 5-page patient education leaflet for PCOS.
Okay.
It is in simple language. So what I've done in my clinic is I've kept printouts of this in my cabin. So it looks like this, you know, I think the camera is blurred.
Because you have a blurred background.
Yeah.
Yes,
so
yes, I
just
can see that.
unblur that. Yeah. So basically, what it does is it is a PCOS RCOG guidelines. It is in 5 pages. So I give this printout to all the girls, tell them to read it. So, you know, rather than going on some random blog and confusing themselves and coming with panic, RCOG has given a fantastic simple language guidelines, which really takes them forward on the right path of PCOS education and guidance.
Correct. Yeah, absolutely. So that is very, very important. What about Madhumita? What do you feel? Do you think radiologists are that much aware in our place of practice, which is in Orissa? And because I so often till now see reports, they don't even write polycystic ovarian morphology. They write PCOD or PCOS. Needs the hormonal FSH, LH correlation. So my question to you is, do you think Orissa, do you think they are aware, or do you think they need more sensitization? Like Sachin said, they have done it over there. What is your thought?
Definitely. Our radiologists do need sensitization. And after all, but I think we are the best people to diagnose and label and anything.
Yes.
So, and these radiologists, we only send them for the reports, many gynecologists who don't do their own ultrasound. So they need sensation.
And also ultrasound is not become a part of, it's now out of, you don't actually need the ultrasound in adolescents at all.
So I think we should be the best people to handle it and diagnose and label and everything.
Yes, true. And Lipika, you to have a fabulous in-house team. So you have the dermat with you totally. How often he sends the patients to you and how often you send the patient to him? How often he sends that this is a PCO patient?
More often he sends to me, ma'am, because very often this age group especially, they are concerned more about the cosmetic issues, about acne, about hirsutism. So more often they have that. And when we both sit and discuss, I always ask him to probe patients regarding menstrual cyclicity. So more often in this age group especially, he sends me patients, and in the reproductive age group, I send patients because they approach me for, you know, like, ma'am, weight gain or infertility or that sort of things. Ma'am, one thing is essential is, like you told, radiologist friends amongst, like, whenever I do a peripheral camp or awareness camps, ma'am, I always talk to doctors that whenever you say PCO, don't write PCOD on ultrasound reports. That's one very important thing. You can write polycystic ovarian morphology. You cannot stamp it as disease because you are not rightly actually equipped to stamp a patient as a disease. That's one thing.
Exactly. You need more criteria.
Yes, ma'am. That's one thing. And radiology is not at all a criteria in this age group. That's another thing. Because the normal ultrasound findings in this transitional age group is similar to what is stamped as PCOM. So this should not be a diagnostic criteria at all. Whenever I see 1-2 of my radiologist friend anywhere also, because they have so many cases. And the second thing where I approach patients is that I always tell the mother that don't do an ultrasound anymore. Not with me, not with anyone. If she has 2 groups of symptoms, she's already either a PCO, adolescent age group 10 to 19, or she's a at-risk person. More so if her father or grandfather or grandparents, any maternal or paternal, have any other metabolic risk factors. She's more likely to develop those comorbidities. And like sir told also, I have developed 2 booklets, ma'am. I've prepared it myself. One is No PCOS to help PCO patients. I have the soft copies of this also, in case the patient is at a distance and doing online consultation. And this is where I spread the healthy lifestyle thing because of lateral inversion, maybe, ma'am. So I give this to routinely to all the patients, and then I made it make it mandatory for them to have a first month follow-up visit in person, because that is essential to see them how much they have lost weight and how much their symptoms are alleviated.
Perfect. So I think the gist of this discussion was that radiologists are not equipped to make a diagnosis of PCOS, because polycystic ovarian morphology is just a part of some types of phenotypes of PCOS women, number one. That is why for the lay public, it is very important to understand that go to your gynecologist to make the diagnosis, to make a correct diagnosis, because it's a long-term disease. So unless the diagnosis is made perfectly, it won't be appropriate. And dermatologists and everybody, usually dermatologists sends to us that, okay, you are getting all these things, go to the gynecologist and see if you have, if you have. So that is the most
very
important.
Sadly, ma'am, I'm sorry to interrupt, just with radiologist report, they have taken cycles of occipils and then they come. Yeah, ma'am, it's very sad to see 2-3 years of continuous occipils they have taken with radiologist report of PCOD written.
Not only that, they come to you saying that please repeat a scan to see whether those cysts have come down or not.
That's what I tell, ma'am. Never do a scan, not with me, not with anyone.
Yes,
ma'am.
No, now the another problem is what is happening, madam, is, one girl who has been put on OCs by some doctor and her friend has one delayed period. That young girl will make a diagnosis of PCOD in her friend and tell her, see, I am taking this medicine, you also start this and your periods will be regular, So forget getting an ultrasound, going to a gynecologist. The adolescent teenager is treating another teenager. Thanks to the social media, that is the biggest problem that we are facing nowadays.
Biggest problem. I know. So the bottom line is let us stop the obsession with ultrasound for the diagnosis of PCOS. I think that in one sentence would be fine.
Yes, ma'am.
Okay, now so what I wanted now to next discuss, because in our first discussion, Sachin, you said a lot about early menarche, you said about obesity, and all those things. So now let us discuss, as yes, it is a global phenomenon, and yes, the PCOS incidence is really rising. But let us come to the scientific aspect as to what you feel is actually driving this epidemic. Now, specifically, okay, let's not discuss about inactivity and bad lifestyle and bad food that everybody knows by now. Let's come to a little more specific. So, Sachin, what do you think early menarche is a factor for increased PCOS? I don't think so.
It's an entire circle. Obesity, early menarche, lack of exercise, insulin resistance, obesity, and that is what is the vicious circle that we need to break, Now, I mean, if you imagine when we were children in the school, we had so much of physical activities. We used to actually go down and play on the grounds. Physical games used to happen.
No, but is it related to the incidence of, is it related to the pathogenesis of pathophysiology of PCOS? The early menarche.
Basic problem is the basic problem is the insulin resistance that we are seeing.
Certainly. So insulin resistance is a driving factor for sure. Okay. But early menarche, we know that early premature adrenarche, premature menarche is part of the syndrome, which is a fact that can make us aware that, okay, this girl might develop PCOS in later years, especially early adrenarche. Premature adrenarche is certainly a factor. Yes.
Ma'am, the Pediatric Endocrine Society in 2015 and 17, they have a revised guideline about the etiogenesis of adolescent PCOS especially, in which they have suggested a 2-hit hypothesis. It's a 2-hit theory wherein they suggest that there is early accelerated maturation of the HPO axis in these girls. because of the genetic hit, intrauterine environment, because of the genetic constitution.
Yes.
They say that there is a genetic predisposition of having early accelerated maturation of the HPO axis. So I have seen very often, ma'am, either early menarche or primary amenorrhea up to the age of 15. Just yesterday, I had a patient in OPD. So there is both delayed and early. Yes, ma'am. Yes, ma'am. But I have also seen girls who are in standard 3 and 4 and they have started menstruating. So I have seen that happen in
so what actually what I am just trying to make a demarcation is that early menarche again is a global phenomenon, and that is probably linked to the early it's related to the pineal gland, and it is related to the early maturation of the HPO axis. That has many factors, their exposure to the environment, early exposure to sexually explicit images, TV, this, that, and the other. So that early menarche certainly is a global phenomenon, but it's not a direct link.
No, there's no direct link in that.
Yeah. That is what I was trying to say. And the next point that I want to discuss a little bit, Madhumita, if you have an opinion, is the factor that of endocrine disrupting chemicals, EDCs. In the environment, and the environment being so bad. How do you feel that is driving the epidemic of PCOS? Do you feel there is any link? You or Lipika, anybody?
I believe it is driving the incidence because of all these changes in the environment. The girls, all that entire cycle of the HPO axis, obesity, and insulin resistance are all working in a cycle, driving up the incidence of the disease in the current generation.
Perfect. Because we have also seen many papers that have linked phthalates and the top endocrine disruptors to endometriosis and PCOS. Definitely through the insulin resistance and obesity pathway. But also directly by inducing changes. I am not very much clear with the exact pathways, but even the endocrine disrupting chemicals probably have and endocrine disrupting chemicals, if you can, Lipika, highlight a little bit for our audience as to where they find it.
Ma'am, it's present anywhere and everywhere, ma'am. Even like you know about the IVF lab also, ma'am. You cannot cut down endocrine disrupting chemicals as much as possible. We can bring it down, ma'am. And one thing I wanted to tell here is nowadays fruits and vegetables are also not completely fresh as they used to be when we were children or you all were young. So it's like vegetables also have a lot of mix of chemicals and fertilizers to mature them early or to make them look more attractive. Watermelon looks so much red nowadays. You wonder whether it's natural or it has some chemical added to it. Even the mangoes. So not the fruits and vegetables.
Everything, whether the toothpaste that you're using or
anything, ma'am, anything.
So there was a very nice article which said nowhere to hide.
Yes, ma'am.
So literally, although you are aware of it, and the younger generation, I hope they are getting aware of the fact that the fast food and all that they're eating and all the rubbish that they're eating, everything has EDCs. But other than that also, our lifestyle has become such that we literally have nowhere to hide from these EDCs. And yes, they also could be a factor which is driving this epidemic. If any one of you can think of any other aspect which is driving this epidemic, we could discuss that. I had thought of these
Very important is stress, ma'am.
Yes.
Stress and the competition.
But what about stress in adolescents? We will come to it a little later in discussion. But I don't mind you talking a little bit about stress.
Ma'am, more than the adolescents themselves, their parents are a lot more stressed ki 5 mark kam kyun hue? So they are under too much stress, ma'am. They say that you don't understand, ma'am. We are having 10th board exams. I tell them I've also gone through this phase. I'm not sitting here without giving 10th board exams, ma'am.
Yes.
But definitely, ma'am, the stress level, the peer pressure, the colleagues, the parents' pressure to do well. She's doing well. Why are you scoring less? He's doing better than you in this subject. So that is definitely adding up, ma'am. And whenever the peer pressure, actually, they have a top level mobile in which this app is there, that app is there. I need to look good. Body image is also affecting them significantly, ma'am. Obese girls having pimples, hirsutism, alopecia, they are significantly affected that way also. So, so too much of anxiety, depression is there.
Yeah.
Basically, I think this stress adds to the stress of PCOS.
Yes, ma'am.
Once you diagnose PCOS, they are on stress, and then the environment stress adds to the stress.
Yes. Yeah. So the stress also is driving this epidemic, because it is certainly aggravating the PCOS epidemic. Yeah. So I guess we have covered a lot about what is driving this epidemic. Although I wonder if we can do anything about it, much to change. But then we have to make an effort to change our the girls and the young people have to change their lifestyle as far as possible. Okay, so now let's discuss another aspect of PCOS, which I really wanted to discuss today, is that it is not solely the prerogative, or it's not solely in the domain of a gynecologist to either diagnose, or maybe diagnosis we can, but to manage these girls of polycystic ovarian syndrome, we need to have a multidisciplinary approach. So dermat, okay, it is understandable. Whenever you, in what situations do you refer the patient, Sachin, to the dermat? Like, see, little bit acne, hirsute, and all those things, I'm sure you will put them on a nice anti-androgen type of thing, or whatever that will reduce, and you will counsel. But there are situations when you feel that she has to go to absolutely has to go to a dermatologist. If you can...
So basically, if she's got excessive facial hair, a lot of hyperandrogenism, a lot of acne vulgaris, where it is really scarring her face. These are the cases where I would definitely recommend her to go to a dermat. Also,
at what
a lot
age
of these
would
girls
you advise
have,
for the hirsutism treatment?
Ideally after the age of 18, but then nowadays the girls are so self-conscious about their images that I would recommend them to go ASAP, because the dermats also are now seeing a lot
of this. But the hardcore treatment like laser and also, Sachin, you feel we should send them so early?
No. So I don't dictate what treatment the dermat should do. So let the dermat decide what is best for our patient. Because the way the dermat tell the dermat that I want a laser done. It's not the other way down. So बोलते ना कि पासा पलट गया है. The tables have completely turned. The girls are dictating that, doctor, I want this.
Yeah.
So really don't know what to...
Ma'am, scientifically speaking, if it's severe acne, like more than 10 lesions, or pustular acne, little bit higher forms of acne, which is significantly distorting the facial looks and is consequently leading on to scarring of the faces after it heals. So that should be ideally referred if the patient leaves it on us for referral. Otherwise, they usually approach the dermatologist first in this age group, especially, ma'am. And if they have significant hirsutism, especially on this chin and upper lip area, ma'am, that is what bothers them the most, on the jawline, on the chin, or this. And if they have a higher FG score, if I assess and they have a higher FG score, specifically these areas, or say the upper chest, the breast cleavage line, that bothers the girl a lot. If she's wearing a dress and that is visible, that bothers her. So if the referral is left on to me, I would refer on these 2-3 grounds. Otherwise, ma'am, they are more concerned about their looks. So routinely they ask for a derma consultation.
Correct. So another aspect is, I would want Nikki to answer this. See, the thing is that what we do is we spend just about a minute saying exercise karo, weight loss karo. Otherwise, this is part of your journey in PCOS. Otherwise, it's very difficult to improve and things like that. We will not be able to give more than 1 minute or 2 minutes to tell them about diet and exercise. So, Nikki, do you feel, and do you in your practice are referring to dedicated exercise counselor, nutritionists, dietitians? Do you do that? Or what do you feel is that to do that?
In Odisha, we do not get these services easily. We can't have, we don't have any nutritionist, and unless you send them to a gym for exercise and all that. So I do spend some time with them and at least tell them the basics, how much of calorie, and they should avoid all this fast food and processed food, and they should exercise regularly and should be very careful with the carbohydrates. This type of, this much of time I do try to spare and tell them. But I think a nutritionalist and exercise, somebody to
Counselors.
tell them about the fitness should be available, and they should be able to consult them.
What's your opinion, Sachin? Because I am sure you get a lot of these services easily available in your place of practice. In Bhubaneswar,
So
we do
have
have, Nikki, we do
yeah.
have dietitians, nutritionists and all we can send. But
And,
Mumbai must be very well developed.
So I
Yeah.
have a dietitian practicing in my nursing home itself.
Acha, okay.
So that is one thing. But Madhumita ma'am, to solve your problem, nowadays a lot of dietitians are doing online consults.
Yes.
Oh, yeah.
So
Yeah.
I mean, you need not really send a girl like dietitians, even psychiatrists have gone, 60 to 70% of their consultations is online. So you
Yes.
know of a particular dietitian who is good, you can just share the number with your patient that this girl is good. You are in Bhubaneswar, she might be in Bangalore, she might be in Gujarat, she might be in Bombay, does not matter, because now with Zoom consultations, everything has changed.
Yes.
And what these dietitians classically do is they will send a questionnaire on WhatsApp to the girls to be filled and their body measurements to be taken, and then they will design a diet plan, and all the further consults will happen online.
Exactly.
So the girl does not really need to go to a dietitian. And basically what we have to advise the girls is to do a calorie restricted diet of not more than 50 calories a day, and 45 minutes of just even brisk physical walking is more than sufficient. No need to go to the gym, basically to take care of the insulin resistance.
Correct. So yeah, so that is an excellent option, that because after Zoom, even the exercise, all these fitness classes are also online, and they have plenty of them doing. So that is an excellent thing. Psychological counseling, sleep medicine, all these. How often do you think, Lipika, you need to send patient to a sleep specialist? Because we have a very good consultant here who is in sleep medicine. How often just give me numbers, how often you need to send to her? Because now I am finding it that, because I have started putting this as a questionnaire in my, earlier I never used to ask. Now I am asking all PCOS girls, how is your sleep? Whether they are thin or, earlier only very obese, morbidly obese people we used to ask. But now I have started asking
from the past W3 webinar on sleep medicine and PCO, actually I learned a lot of things from the sleep medicine expert there. So before that also I was asking about the quality of sleep and the hours of sleep. So even one very good point is that not only obese PCO patients will have sleep disorders, because it's not only related to the neck problems or to the muscle problems, it is basically intrinsic to PCO, related to the hormonal imbalance, and the some reason is there, intrinsic reason for which they're not able to sleep, because of the apnea is not only related to obesity. So that's what I learned from that webinar. I already had a questionnaire, ma'am, from madam only I had. So if I ask them, you are having less than 3 hours of sleep in the night, late onset of sleep, and late waking up time in the morning. So I still have, like you do, it's not an emergency to meet the sleep physician immediately, but you try to meet her within the next 1 month before you meet me. So that's what I tell them routinely. And psychological counseling, ma'am, I am the person, because I'm exclusively dedicated to PCO and infertility and sexual medicine. So I give around 40 minutes of counseling regarding if they are depressed, anxiety, that comes in the lifestyle counseling only, ma'am. But for sleep medicine, I routinely do a consultation on these grounds. And I tell them, before we meet next, just have a meeting with some sleep medicine physician.
Because
can I suggest one thing, ma'am?
Yeah.
The best way to ensure that our patients and ourselves get a good sleep is to tell them to switch off all their devices 1 hour before they hit the bedroom. Once that is done, trust me. And second thing, what they have to do is, because of a lot of LED lights around, the brightness in the rooms is very high. So to pull the curtains and switch off, not silent mode, not airplane mode, it has to be switched off unless that person is a doctor. Switch off the phone. Switch off the phone, and trust me, their sleep patterns will improve.
I add to it, sir. I tell them, don't take your mobile phones to your bedroom.
Sorry, I said I don't agree with you that they only have to be doctor. If you are a mother with children, you can't switch off your phone.
That's just about it. And one more thing, sir, I always tell them, don't take your mobile.
If you are a child, take your mother to the bedroom. Mother, you cannot switch off your phone. So
Right,
literally you can't switch off your phone these days. Anyway, yes, but absolutely right. Sleep is a very big issue, and yes, we should be dealing with multiple specialties. And we always need the help of multiple specialties. I have not put so many other specialties that we would need. We would need the endocrinologist, we would need the geriatrics. I mean, generally, but adolescent, yes, these are the people that we would need. And so quickly, I think we don't have too much time. Let us quickly discuss from the point of view of a general public, how to make a perfect diagnosis. I want each one of you just to give the clinching points. For example, if it is the role of ultrasound, Sachin, what would you advise?
So basically,
to make a diagnosis.
up to the age of 18, no ultrasound to diagnose adolescent PCOS.
Perfect.
Only after the age of 18, ideally a transvaginal ultrasound if she is sexually active. If it's an abdominal ultrasound, the volume should be more than 10 cc's.
Perfect.
If it's a vaginal ultrasound, volume more than 10 cc's with more than 20 follicles per ovary noted. That is the non-negotiable diagnosis for PCOS on ultrasound. Perfect.
Lipika, are there any hormones that we need? Because even the general public, they don't understand. They take the ultrasound and then they come back. And also many people tell them, do insulin, do this, do that. Just tell me, do you need any hormonal test to make a diagnosis of PCOS?
Perfect diagnosis is a misnomer for this age group, because it's not, perfect diagnosis is not possible, especially for this age group. Second thing is that, ma'am, as we all know, PCO is a diagnosis of exclusion. So only in regards to that, the Pediatric Endocrine Society and the Endocrine Society of India in 2023, they requested all the gynecologists to do 17-hydroxyprogesterone just to rule out adrenal causes, non-classical congenital adrenal hyperplasia. Rest of the tests are basically not required, ma'am, for diagnosing. No particular
so for diagnosis,
hormones.
Generally, we don't need anything. Only the gynecologist may, in certain situations, feel it right to do some tests.
Yes, ma'am.
Right?
Yeah. And ma'am, in order to rule out other associated diseases like hypothyroidism or prolactin excess, you can just do a TSH, ma'am, if required, not for diagnosis.
Yes. So the only two hormones that you will do is the thyroid function test and the prolactin. Other than that, we don't need to make anything for the diagnosis. Right. Nikki, what do you tell us how to make the diagnosis based on the signs and symptoms? Like somebody says, I have 10 days delay every month. So what is the criteria that you will choose? Or, So
in this adolescent age group, it should be less than 22 or more than 41 days in the adolescent age group. And should have about 8 cycles per year, less than 8 cycles per year. Correct. That is when we start getting concerned, and we label them that they have to be followed up for a PCOS diagnosis.
What about acne and hirsutism? Because even both of them are acne
also common.
Part of adolescence.
Part of adolescence. So it is, I think, hirsutism is more significant if it is there. But again, for that, we need to wait to see what type of adult hair, how it grows. So most important is this irregular cycles, which should be the common complaint that they come with.
And you will take the criteria as per the guidelines and then decide whether she falls in the category of oligomenorrhea, irregular cycles. Correct.
So, madam, can I just add one thing?
Certainly.
The conception, the idea that a woman should have a period once in 28 to 30 days. So what I tell the PCO girls, and most importantly their mothers, is that in the RCOG guideline, it is mentioned that if the woman is going to have period once in 1.5 months or 2 months, it's not a bother. The main thing should be that she should have minimum 4 periods every year. That is 1 period every 3 months to prevent the negative effects of excessive estrogen buildup and endometrial hyperplasia. So if this girl without any medications is getting periods once in 1.5 to 2 months, just diet, exercise and vitamin D supplementation. And I've got a lot of young girls where just diet, exercise and only vitamin D supplementation, and literally their periods have become regular. Nothing else.
Absolutely. Absolutely. Okay, so I think we can start looking at some questions that we have. Or do we not have too many questions? In that case, maybe I can just quickly take your opinion, each one of you, as to see these programs like this, Vijeta from the PCOS Society under the guidance of Dr. Durusha is one of the best ways to create awareness about PCOS and the rising incidence. What in each one of yours opinion, we can start with you, Sachin, is that how we can improve awareness?
So with Dr. Durusha only, when I was, it's almost 10 years back, we used to have this sexual health awareness workshops in the school. It was with Foxy and Johnson & Johnson. So what our associations can do is we can go to the schools and sensitize the girls about PCOS, misconceptions, actual scientific facts, and how to tackle it and how to get it treated. So it has to start at the school level, where we can invite the school girls as well as their parents to come and participate in the seminars.
Correct.
So this we had done.
So going to them is also a good idea. Nikki, do you have any ideas by which we can increase awareness?
Yes, definitely schools, even colleges and women's club and also can be included in the sensitization bit, because even the ladies, young reproductive women also need to be aware of it. And its consequences. I'm more keen that the consequences of this they can be diabetic, hypertensive, cardiology diseases, and all that. So we need to sensitize all the age groups, not only in schools.
Correct. Lipika, any ideas that
Ma'am, my part is I do always a camp, PCO camp, once quarterly, every 3 months, wherein we have a yoga person, a nutritionist with us. He speaks the cosmetic part, I speak the infertility and gynae part, adolescent part. So we do that quarterly, routinely for last 3 years we have been doing. And the videos that I have recorded, I do it in my clinic, ma'am. My clinic on the rooftop, we arrange a breakfast and we do that. We have a slideshow, they can interact. My past patients, they can bring their friends. So I do that every quarterly, ma'am. And whatever videos we have or programs we have, we play it in the lobby. Any PCO video. So when they are waiting also, they have to see that. And I also routinely do physical programs in colleges and schools. With Vijeta also, ma'am, corporate sectors, they are doing these webinars. I did one last for DHL India this Thursday. So they are doing the Vijeta people, they are doing corporate programs, online webinars on different topics of PCO as well. We have a template slide prepared from the PCO Society. So we keep doing that. I think 5 to 6 sessions every month is being done.
So so social media, schools, these are probably the best ways to reach out to girls, because see, people, I think more important is to reach out to them, because they may not, they would rather go and see other stuff on Instagram and Facebook Live and all that, and not always watch what is meant they are supposed to be watching. So yes, targeting them and going to them and making it interesting is probably the one of the best ways. So I think we had a fruitful discussion, and people were there who did take back some useful information from us. There are 1 or 2 questions.
Ma'am, yes. Can we start with can we address
I think
some
we
of the
have
questions?
just 2 questions. One is, my daughter is 18 years old and has not been having regular periods. Last she has had was in December. She craves for sugar, food, has acne on her face and a bit overweight. She suffers from regular headaches and perpetually tired. How can I help her? Sachin.
So this is a classical thing that we've just discussed. She needs a complete whole round approach. She and her mother both, actually, wherein the diet needs to be changed completely in the house. The lifestyle needs to be changed, probably psychological counseling, which Lipika can help around with. And as you mentioned, sleep apnea. So what I tell these girls nowadays is, there is this nice wedge pillow which is available. It is available on Amazon for 2,500 rupees by a good brand called White Willow. So it will give you a elevation and thereby prevent a tongue fall from happening. So that helps in sleep apnea. And of course, weight loss, so weight loss.
So let us say this 18-year-old girl, like you said, is the classic case. How much she will listen and all that is another matter. So it needs to be handled with care.
So actually what is happening is, when we tell them that when they go to college, they might have a problem of not getting accepted in groups. That really hurts them hard. Because see, they want to get accepted, right? I mean, they don't want an ugly looking person in their group. So that is where it hits hard. And
so I would say, if I can just sum up we can't help much on this kind of a platform, our patients who have asked questions.
Right.
But let's say for this mother who is asking about her daughter, if I can just put one or two sentences, maybe the first thing would be that the whole family changes their lifestyle and their eating habits.
Yes.
Parents, everybody, younger siblings, everybody has a yoga session every day, has proper food that is cooked at home. So that let them start from the family and help each other. Not that just be after this one person and then take some help about irregular periods, because irregular periods we have to define properly. So now the next question is homeopathic medicine and weight management help in reducing symptoms of PCOS? Now, who will take this? Homeopathic. Nikki, you want to take?
I don't know anything about homeopathy, but weight reduction would definitely help. Whichever way, homeopathy, allopathy.
What about alternative medicine? Any one of you has an opinion? Lipika, Sachin, I'm sorry. So we don't know much about homeopathic.
Weight management, yes.
Like ma'am says that if she can lose weight, be it any way, ma'am, that's beneficial.
Yes.
If she's doing well with homeopathy medicine, that's good.
Yes. Now, I am from UK. The third question. This is an important question. Really important question. I am from UK and my daughter has been advised mini pills by the gynecologist. I don't know why she has been advised. But she has been having episodes of headaches and migraines. So we are so confused what is the best treatment for her. Now, how do you want to take it? Sachin, you want to take this? We have no idea why she has been prescribed mini pills in the UK. And what is the age of her daughters? But yeah.
Mini pills, is it progesterone only?
Low dose. No, low dose.
Low dose pills. Okay. So first and foremost, I mean, I don't know why they have started her mini pills in the first place. We should basically look at lifestyle changes, and I would probably add this kind of a person insulin sensitizers rather than straight mini pills for taking care of the root cause of the problem. And it is very clear that her migraines and headaches are most likely due to the estrogen side effects of the mini pills. So mini pills have to stop immediately. And secondly, that she needs to get checked is her checked blood pressure also, because that elevated blood pressure might also be the cause of getting her headaches and all that.
Correct. So presuming that she has been put on mini pills and that she is a case of PCOS, then definitely they have to be stopped. She has to undergo further evaluation, and then somebody has to see what is the best possible option for her. Because if she is getting headaches and migraines with mini pills, or rather the low dose OC pills, she will also get it more with the progesterone withdrawals and all this. So this is a difficult thing to solve just on this platform, and she needs proper evaluation. Then the next one is, I am literally worried with my health, doctor. I have been facing heavy spotting just right before menstrual cycle starts. The spotting starts 10 to 14 days prior to my cycles. And after the menstruation end, it stays normal for 10 days. And again, the same heavy spotting starts. So basically, mid-cycle spotting starts and stays till she gets the next period. What can be done for this? You can suggest. I'm also overweight. I'm 24 and weighing around 89. So BMI will be around 35 or whatever. So 30, more than 30. So any one of you wants to take?
It could be just ovulation spotting. I feel if it
starts.
No,
she's getting heavy spotting for 10 to 14 days prior to cycle. I would say this is a situation where she needs more evaluation. An ultrasound is needed, a pap smear is needed, a physical examination is needed, and then she will have to be put on some kind of a hormonal medication to control her spotting. Why? Maybe she has some physical factor like a endometrial, factor. So this is not something we can solve here. Okay, what to do for extreme tiredness and headache symptoms of PCOS?
Ma'am, for tiredness, it could be due to hypothyroidism associated with PCO. So we need to evaluate her thyroid function, and like sir told, because it's a pre-metabolic, it's a metabolic syndrome kind of thing. So we need to get her blood pressure measured, her lipid profile and all evaluated. And headache would also be due to refractive errors. A simple reason, but it could be due to refractive errors, due to dental caries. So all of those things need to be ruled out. Not everything is linked to PCO, ma'am.
Lipika and Sujata ma'am, I'll add another angle to it. A lot of women, especially working women, they don't drink water because washroom facilities are not available. Because of hardly half a liter of water they will drink in the entire day. Because of which they are chronically constipated, which causes headache. And this chronic tiredness can also be a symptom of extremely low hydration. So if this particular woman is not hydrating herself well, she needs to drink at least 3 to 4 liters of water a day. If she's getting constipated, she needs to take care of that as well. And then also we have to think about all the things that Lipika rightly said.
Yes, absolutely.
Because water intake is such a problem in adolescent girls.
And we have just 3-4 minutes, so let me put that with many supplements coming in the market, like PCO drink, inositol, berberine extract, metformin, some coffee beans, this, that, I don't know how many. Whether these benefit adolescent girls? Question, yes or no? Let's have a yes or no answer. Sachin, yes or no? No. Nikki, yes or no?
No.
Lipika?
Yes, ma'am. Ma'am,
Which
I
one
feel
will
that
help?
all of this, no, it's not which one will help, ma'am, because most of the things have combinations. They have usually the selenium, berberine, and they say chasteberry extracts because they are more likely antioxidants and they reduce anti-inflammatory.
Benefit the adolescent girls? So
it's
you
not
have to
about
guess,
adolescent
give specific
PCO,
answer.
Yeah,
whether it will improve their menses or it will help them in weight loss or what it will improve.
Yes, ma'am. Ma'am, PCO is basically an inflammatory condition. I have used antioxidants with PCO, especially in this age group, where you cannot give too many other medicines like OC pills without thinking. I just give an insulin sensitizer and some nutritional supplements like this. So these are basically anti-inflammatory drugs and antioxidants which bring down the inflammation level in PCO. So PCO is definitely a pro-inflammatory condition.
I'm sure that many of us practice in different manners, and yes, amongst our panelists, you feel that these are may benefit in some way, and your logic is also absolutely right. But I would also think that one is open to discussing on these. I would say they should discuss it with their doctors and then see the advantage, because they are not cheap, and then decide whether they want to take it or not. Now,
and the very how long will they take it?
Yes, that's another point. But that's going to be another big discussion only on inositols and supplements. Right. So the very last question let us discuss. This is Pavitra from Chennai. And I have a clarification that during educational and research times, a girl is prone to spend more screen time to complete the project. Exactly what we were discussing, and work before deadline. So it is fine to take this up and spend few sleep-deprived nights to work in a month, like 10 to 12 days in a month. Will it be fine, or how can she manage PCOS with this situation? What she's saying is absolutely right. Which means that in your working, in your prime of your age, when you are building up your career, everybody needs to work hard. We have all done it. We have all had 17, 18 hours a day during our final MBBS and other examinations and stuff. So how do you address that? 10 to 12 days in a month, she'll not have good sleep, this, that, and the other, and then you will lecture her about how will you manage PCOS if you don't sleep properly.
No, so just tell her one thing, that after every hour of screen time and working on the computer, get up, stretch yourself, do a few Surya Namaskar.
Done. Fabulous.
That is the only thing that is needed. And post dinner and post lunch, 10-minute walk.
Yes.
And if she stays in a building, she just needs to climb the stairs.
Down the stairs.
She does not need to take any gym, no fancy supplements, nothing. Just how to include, if she's going by bus to some place or Uber or Ola, she can probably get down 1 kilometer earlier and walk it down. To include walk in their regular day-to-day regime and schedule.
Absolutely. Thank you so much for saying that. That's very, very important. And goodness, now the last question, how to treat excessive hair fall due to PCOD?
Send to Lipika's husband.
Ma'am, it's all a multi-approach thing. Like lifestyle changes is the crux. And when I start an insulin sensitizer, they always ask me, ma'am, should we start laser and all simultaneously? I always tell systemic problems are major behind these cosmetic concerns. So go for your systemic correction first and try lifestyle and medications first for correcting your hormonal imbalance for 3 months at least. Then think of higher forms of therapy if it's not getting resolved with that. So I always say you haven't developed the symptoms in a month. So it's not going to get resoluted in a month also. So it will take time. Give yourself Give the doctor also
But
6
hair
months
loss
time.
is a very big problem. No doubt about that. But then I tend to tell people, I don't know, correct me if I'm wrong, I tend to tell people everybody is having hair fall because of the bad water, bad food, stress and everything. Of course, PCOS women have a reason also why they are, because of their high testosterone levels and all that. But hair loss is a difficult problem to treat. And everybody almost is facing it these days. So I think we had an excellent discussion. Priyanka, we are through with our discussion and everything. I hope the
Yes, ma'am.
audience got some good take-home messages.
Definitely, ma'am.
Thank you so much to my panelists, Dr. Sachin, Dr. Madhumita, Dr. Lipika. I hope we will get such opportunities again in the future.
Thank you, madam. Thank you so much. That was a really enlightening panel.
Thank you. Thank you.
Thank you, Sujata. Thank
Yeah.
you. Thank you.
Thank you.
Thank you, everyone. Thank you so much, all the panelists, for giving your valuable inputs and giving your time contributing to this cause. We had a very insightful and in-depth discussion on diagnosis of PCOS, and it's going to be very useful for all our viewers or somebody who is struggling with the signs and symptoms, so that all the discussion is going to be very fruitful for them. So thank you, Dr. Sujata ma'am, Dr. Madhumita ma'am, Dr. Lipika ma'am, and Dr. Sachin Dalal sir. And thank you everyone who has come and joined us for today's panel discussion. Also, this panel discussion wouldn't have been possible without the efforts of Dr. Durusha ma'am, Dr. Shobna Patel, Dr. Ruby Sound, and the team of Vijeta and our backend team, the web stream. Also, for anyone who is watching this, if you have any queries, please feel to contact us on 915-2919-221. So with this, we'll end today's panel discussion. Thank you. Thank you.
Thank you very much.
Thank you.
Thank you,
Bye,
everybody.
everybody. Bye.
Bye, ma'am.